Hi all, my name is Brandon Freeman. I'm a physical therapist here at Portland Physical Therapy. I'm here with my friend and colleague, Sam Powell. Let Sam introduce himself.
My name is Sam Powell. I'm a physical therapist up in Rockland, Maine at Continuum Physical Therapy.
Yeah, so we're here today. We want to make some videos, some suggestions of some of the exercises that we use with our patients to help them get better on some of the things that they're dealing with. So the first exercise that we'll start with is what I call just kind of core awareness, lumbo-pelvic positioning, and how to activate the muscles to help stabilize your back for low back pain, hip pain, and some of those things. And this is how we talk about it with our patients. So if you're dealing with some back pain or some hip pain, that kind of stuff, oftentimes we lose some coordination and control within our low back and our pelvis, and we kind of lose the ability to fire the muscles the way that we want to fire them. So the way that I teach some of our patients to do that is, as we're laying on the table, is can they do pelvic tilts. So a pelvic tilt to me, or for us, is how we rock our hips back and forth. So if Sam were to lay here and flatten his low back against the table, that would be considered a posterior pelvic tilt, is what we call that. If he can go the opposite way and make some room underneath his low back, that's an anterior pelvic tilt. So based on our examination findings, what we do with our patients is we suggest that there's a position that their back is probably going to be best in. So for Sam right now, what I'll ask Sam to do is do a pelvic tilt, go back and forth until he finds a position of his low back that feels best for him. So it could be anterior, it could be posterior, it could be somewhat in neutral. So once he finds that position, I ask him to hold that. And then we ask them to contract their abdominal muscles. And now this is not a big, what we call a gross full body contraction. This is a pretty specific focal contraction down the lower abdominal muscles. So what we do is I find the bones in the front of our hips here, and then I just go a little bit in from that and I palpate on our patients. And I ask them if they can contract that muscle and tighten that. So Sam, can you do that? Great. So now I can feel that tension underneath my finger. At the same time, I want to make sure that Sam can breathe and not hold his breath, because that's not what we're trying to do. That's called a Valsalva maneuver. But what we're trying to do is create an abdominal contraction. So as he's sitting there and holding this tight, I ask if he can take a breath in and out, which he's doing fine. And then usually I ask my patients to try to hold that for about 10 seconds while they're breathing, and then we ask them to rest. And then we go back into that for multiple repetitions to try to retrain the brain on how to do this exercise, retrain the brain on how to fire those muscles and find those muscles so they can stabilize throughout their day and their normal daily activities.